What we do here at Texas Back Institute is a combination of things. We consider ourselves to be experts at the evaluation and treatment of all spinal disorders from top to bottom, whether it's an acute episode of back pain all the way to complex deformities, tumors of the spine, infections, and other more serious conditions. So when a patient comes to see us, they're going to be evaluated from that perspective and from that breadth of experience and knowledge. What we will do in general is review with the patient their history, what their symptoms are and what their complaints are and what their goals are. Try to get to know them a little bit, what their life is like and how they would like to proceed in terms of their workup and treatment. And we will also examine them, review all of their previous records, and try to formulate together some kind of plan to meet their goals and expectations, and if possible exceed their expectations whenever we can. This sometimes involves elaborate testing, sometimes it involves something as simple as a conversation or some reassurance. We try to maximize conservative style of treatment such as physical therapy, or injection treatment, exercise, and so forth, before we consider more invasive modalities like surgery. I really try to approach each patient as though I were in their shoes. I try to recommend to people what I think would be appropriate for me based on my own knowledge of spine problems. I don't try to simply tell people what they want to hear, but rather try to do my best to educate them about their problem and get really to the core of what it is that they're trying to get out of their interaction with the Texas Back Institute and provide that for them. There are some situations where we can do miraculous things for people without necessarily expending a lot of healthcare dollars or a lot of energy on the part of the patient, simply by having a good conversation and having them understand better what their problem really is. Very often, patients that come to see us have seen lots of other doctors, and actually that is often helpful to us to understand exactly what happened before that patient came here. So bringing along records, MRI scans, any other tests that are relevant to the complaint is really the most important thing that you can do in preparation for an evaluation here. I'm Dr. Ted Belanger, MD, an orthopedic spine surgeon with the Texas Back Institute.